Unlike Americans, polls show Canadians are overwhelmingly proud of their healthcare system.
I ask my students every year, what is it that you think makes you Canadian? And they come up with the 3 H's, which is healthcare, hockey, and Tim Hortons, which is our answer to Dunkin' Donuts here in Canada.
By now, most of us are familiar with Canada's nationalized healthcare, covering all its citizens. But for George Zeliotis of Montreal, a free operation came with a cost, a long wait time.
And the pains were excruciating. I couldn't sleep at night. I had to get up. Sometimes I had to open the door in the middle of the night and walk outside. I was going bananas.
In 1997, George, then 65, was told he needed a new hip. He got it, but he had to wait for more than a year.
In a free society, a government cannot oblige a person to suffer or to die on a waiting list just because of the will of a government.
Physician Jacques Chaouli teamed up with Zeliotis to fight the system. They sued the province of Quebec for the denial of care during the year-plus wait for George's operation. Nearly 10 years later, in a ruling that rocked the country, the Supreme Court of Canada ruled in their favor.
As the result of the court case, Quebec is now just a bit more American than the rest of Canada. Patients who have the money may now get medically necessary treatment at private clinics when they want it, although the ruling is confined to certain operations where there are traditionally long wait times.
It was a narrow decision, a controversial decision.
Canadian healthcare expert Antonia Maioni.
But at the end of the day, the Supreme Court suggested that there were certain kinds of practices that might do well in being covered by private insurance, not just public insurance.
The result? While small, the number of private health facilities is growing. In Quebec, there are now about 20 private MRI clinics. Dr. Robert Willette runs several of them in suburban Montreal.
It could be 6 months, 6 to 8 months to have an MRI as an outpatient. And so that's why some patients, they don't want to wait that long, and so they come to a private clinic.
Dr. Willette also heads the Canadian Medical Association and firmly believes more privatization would be a good thing for Canada.
If the public system was serving well the population, there won't be any clinics like this.
Norman Pelledo came here because he wanted an MRI right away. He's taking a trip soon and is worried about his sciatica. He paid 650 Canadian dollars, about 515 in America, for his scan. He told us he was impressed with the service he received at the private clinic.
You got that special attention because you could pay for it.
Exactly, because there's a lot of money for 15 minutes.
But that experience is precisely what worries critics of increased privatization, who fear it will create a parallel system of care solely for those with big wallets. Dr. Willette's clinics are for-profit businesses, but he says making money is not the driving force here.
To your critics who say this is why these things exist, to be able to make more money.
There was a need. I think I've helped my citizens, my patients.
It will crush our system if we rapidly go into privatization.
Dr. Maurice McGregor, who opposes privatization, says the opportunities in private practice will drain the national system of its best people at a time when doctors and nurses are already in short supply.
If 20% of the middle class take out insurance and go private, they will immediately snap up the human resources which we haven't got, which we're very short of.
Dr. McGregor, former dean of the medical school at McGill University, practiced before universal coverage was implemented in the 1970s. He says the principles upheld by the Canadian system, where money is neither a help nor a hindrance to getting good health care, are too valuable to jeopardize.
It's wonderful to be able to say, you need that, write it out, you got it. It's a glorious way to practice. I wouldn't go back to the other.
One thing both sides agree on, almost no one in Canada wants U.S.-style health care.
People in Canada are very afraid to have a system like you have in the United States.
Why is that?
Because we've heard so many stories, people losing their houses, having to get mortgage to pay for health care, and this is scaring for Canadians. We want to avoid that.
Since George Zeliotis' court victory, The government of Canada says wait times have improved across the country. Zeliotis believes his lawsuit helped make that happen.
If it wasn't for me, and they had the law that existed before my court case, instead of waiting 1 year, maybe you would have waited 2 or 3 years. In the end, you die.
I'm Edie Magnus reporting for Worldfocus in Montreal, Canada.